Now I call upon Dr. J. Balavenkat to present the Dr. M. Venkat Rao oration. Dr. Balavenkat, please. Dr. J. Balavenkat is currently working as Senior Consultant and Academic Director of the Department of Anesthesia at Ganga Medical Center and Hospital, Coimbatore since 1995. He did his undergraduation from Coimbatore Medical College, DA from BJ Medical College, Pune, and MD from Postgraduate Institute, Chandigarh. He secured the University First and Gold Medal in both his DA and MD exams. He was the Founder President of the Academy of Regional Anesthesia of India. He was the Scientific Committee Chairman of the Golden Jubilee Conference of ISA Goldcon in 2002 at Coimbatore. He is in the editorial board of the Indian Journal of Anesthesia in the Journal of the RSICP. He is the course director for Escalop Academy, Ganga Hospital Regional Anesthesia course since 2005. Trained more than 450 anesthesiologists from India, Nigeria, Philippines, Oman, Bangladesh, Sri Lanka, Pakistan, Egypt. Course Director for WFSA ISA Ganga Hospital Regional Anesthesia Fellowship Program. The first batch of trainees are from Rwanda and Nigeria. Course Director for Dr. MGR University Postdoctoral Fellowship in Nerve Block and Pain Management. He is a certified instructor for CTLS. Invited faculty for the World Congress of Anesthesia in 2008 at Cape Town, South Africa and 2012 at Buenos Aires. Invited faculty and conducted workshops in World Congress in Regional Anesthesia 2014 at Cape Town, South Africa. Has delivered 274 lectures nationally and 22 internationally. He is married to Sashikala and has two daughters, Kavya and Danya. Father S. Jagannathan and mother J. Sundari. Dr. J. Balavenkat to present the oration.
Pranams to everyone. I seek the blessings of the Almighty, the presiding deity, and the world-renowned Meenakshi Amman Temple at Madurai to shower her grace on each one of us for everlasting prosperity. Respected Chairperson, the President of the Indian Society of Anesthesiologists, Professor Dr. Chakra Rao, the Honorary Secretary of Indian Society of Anesthesiologists, Dr. Bhimeshwar, esteemed members of the Governing Council of the Indian Society of Anesthesiologists, all the leaders who made ISA what it is today, including all the past presidents and the leaders and the presidents of the state and the city unit of the Indian Society of Anesthesiologists, who have immensely contributed to growth of this organization, senior members of the profession, my teachers, my colleagues in anesthesia, faculty, Indian and international faculty attending this conference, the young and the vibrant postgraduate students, invited guests and friends. I consider it as a great privilege and honor to deliver the Dr. Venkat Rao Memorial Oration for the year 2014. It is indeed a huge responsibility that I need to do justice and a befitting oration for this year. At the outset, I would like to sincerely thank all the leaders of the Indian Society of Anesthesiologists for giving me this rare honor. The Indian Society of Anesthesiologists, as you all know, is the second largest anesthesia organization in the entire world. So we have to prove to the world that we have emerged as a force and we will conquer what has been left behind. And I am 100% sure with the leadership that we have, we will achieve it very quickly in the days to come. I take this opportunity to thank the entire organizing team of ISACON 2014, led by Dr. Ganesh Prabhu, for their outstanding work in making this national meet a very meaningful one. I would like to mention, I did a workshop day before yesterday, a live workshop in the government hospital in Madurai, and believe me, the standards that they offered were of international. I thank the organizers for putting all their efforts to make it such a wonderful event. It shows that India has arrived of its age and we are ready to face the world with greater amount of confidence within us. I take this opportunity to thank all my teachers who taught me to give spinal, who taught me to intubate, who taught me to take care of my patients. Initially in BJ Medical College, Pune, and later I did my MD in PGI, Chandigarh. At this juncture, I submit myself for the amount of confidence and teaching they did to make what I am today. I also take this opportunity to thank the institution which I work, the Ganga Medical Center and Hospital, Coimbatore, the founding Dr. J.G. Shanmuganathan and his wife of the Ganga Hospital, the directors and the surgeons whom with I work, Dr. Raj Sabapati and Dr. Raj Shekharan, my team at Ganga Hospital and the Department of Anesthesia at Ganga Hospital for showing me the right path to grow and for being very ethical in whatever practice that we do. I also take this opportunity to thank my parents and my parents-in-law for giving me the right kind of values that I need to follow in my professional and personal life. I take this opportunity to thank my wife and children who have shadowed me throughout my career and who have helped me to grow in what I aspire to be. I take this opportunity to thank each one of you for spending your time here, and I'm sure at the culmination of this lecture, we will come to a consensus that we are going to emerge stronger. Professor Dr. Venkat Rao was the father of anesthesiology in Andhra Pradesh. He was also called the state anesthesiologist. Professor Venkat Rao added dignity and dynamism to the field of anesthesia way back 4 decades ago. He conducted the first independent conference of ISA in 1965 at Hyderabad. He was also the president of the Indian Society of Anesthesiologists in the year 1979, and he was conferred the Lifetime Achievement Award in 2001. Born in 1928, he gradually grew up to complete his medicine, his diploma in 54, fellowship from Royal College in 65, worked in Government Medical College, Hyderabad, Osmania Medical College as professor and HOD, Then he went on to become the superintendent of the Osmania General Hospital, later the director in 1979-81, and he was the chairman of the Advisory Board of Health in 1984 for the state of Andhra Pradesh. Absolutely befitting that 4 decades ago, he not only acclaimed himself in the field of anesthesia, but also became a true leader in taking up the organizational responsibilities. I wanted to get an insight into Professor Venkat Rao. So thanks to the inputs that I received from Dr. Thakur, Dr. Bhimeshwar, Dr. Chakkar Rao, Dr. Manimala Rao, and Dr. Du Karunakaran, I also had an opportunity to speak to his youngest daughter, Dr. Rekha Vankini. She is a physician in the United States, and she recollected from her fond memories about Professor Venkat Rao, which I'm going to discuss with you. Early life, he grew up in a poor family of farmers, but always knew without doubt that he was gifted and he had intellectual details were so easy for him to grasp. His mother, Narasamma, who he lost at a very early age, supported his academic pursuits with what little money she could spare. Because he could not meet both the ends meet, he started writing accounts for the local landowners, and he started making money for himself to pursue his education, to buy his books. She says, our parents had a typical Indian marriage, Amma being a perfect homemaker, and Nana, that's how they call the father in Andhra, as the provider. When they were the kids, he never failed to buy them new books. He always bought them new books. He had 3 daughters, but every time he bought new books for them, because when he studied, he always studied with the old books. So he wanted them to get new books, and he wanted them to feel the crispness of the book, and that was his commitment to his children. He had lot of generosity because he suffered a lot in his childhood. He made sure that he gave a helping hand to several children to study well during the younger days. He was religious to start with, but became an atheist later on, and this was probably because of his intellectual growth. He was ahead of times. He got an answering machine to his house way back in 70s when nobody even thought of it. So he showed it everything, the way he lived in his way of life by being ahead of times. She describes as a whole, he was brilliant, forward-thinking, compassionate, hardworking, and above all, very dynamic. More than all those qualities, what the children cherish the most is that at all times we knew we were loved unconditionally, and that he was so proud to each of his daughters in their own unique ways. This is a true lesson for all of us as father and mothers, that we have to give a lot of time to our children as they grow, even though we are a busy professional following the footsteps of Professor Dr. Venkat Rao. I convey my sincere thanks to Dr. Rekha for sharing an insight into the legend Professor Venkat Rao. Now, I will move on to the topic. The topic I have chosen is probably a topic which will be close to each one of your heart. Leadership in anesthesia, challenges and solutions. What I'm going to discuss with you and talk to you today is a summation of what I gathered from my seniors, from my colleagues, inside my hospital, outside my hospital, and throughout the country and across the globe.
October 16, 1846. William Thomas Green Morton, a local dentist, performs the first public demonstration of anesthesia at Massachusetts General Hospital in Boston. Though the operation, performed by one Dr. John Collins Warren, ultimately failed, Morton's administration of ether did succeed in rendering the patient unconscious and completely numb. When the patient emerged from the anesthetic and reported having felt no pain, Warren turned to the audience and said, "Gentlemen, this is no humbug." This day ranks among the most iconic in the history of medicine, for it was the moment when Boston, and indeed the United States, began the journey towards public acceptance of pain relief.
Truly, that was the iconic day when the specialty of anesthesia was born, and as it was born, there was born a specialty which all of us belong, which sacrificed itself to alleviate the suffering of the needy and those who are pain, those who were in acute pain, those who were in chronic pain. Born was a specialty which dedicated itself to the humanity and for the well-being of the humanity. What started our journey 170 years ago started slowly getting permeated into all the nooks and corners of this world, and at this point of time, the anesthesia specialty has blossomed. It has taken over the cuddles of the reins of various things. From a small beginning in Massachusetts General Hospital, is grown as a huge forest, giving greenery to mankind and alleviating their suffering. I'm sure all of you will agree with me that if we call anesthesia as the mother of modern medicine, yes or no? You know why? Is there any other specialty known to humankind in medicine that reads about any other specialty during their post-graduation? No. Whereas we read everything about cardiac surgery, thoracic surgery, pulmonology, cardiology, obstetrics, radiology, ENT, ophthalmology, you name it, we learn it. Do you agree with me? Is there any other specialty in the world which leads anesthesia to the extent that we have read about them? Yes or no? So, which means, truly, we have encompassed all the specialties in one brain, and that's why I would call anesthesia as the mother of modern medicine. When God created us, we should be very thankful for creating us as a human being. More so, we should thank Him for making us a doctor, but more importantly, among the doctors, God's special children was only the chosen few who are the anesthesiologists. Because they are the guardian angels for innumerable number of people, and the most common symptom for a person to come to the hospital is pain. And this is the only angel available on earth which takes care of pain in its fullest. So we are the special children of the God Almighty. We are probably the most sacred branch of modern medicine because you are there whenever there is a question of life and death. Wherever there is resuscitation, whether it is a call to the heaven or whether he is going to stay back on the earth, in treating critically ill patient, in treating major traumatized patient, making a difference between life and death, there is only one profession in this world which comes always to the need of the needy, and that is the anesthesiologist. So it is the most sacred branch known to mankind. So the special children, those who are so sacred in what they are doing, have they got the right kind of fabric that they should have for all the good that have been doing? Let us analyze what happens to the fabric of an anesthesiologist. Each specialty has got a fabric. You can say orthopedic surgeon belongs to this group. A cardiothoracic surgeon has got a fabric. A neurosurgeon has got a fabric. Similarly, an anesthesiologist has got a fabric for himself. And it is so important to introspect into the fabric of this anesthesiologist, because we will understand the lacunae that are present and we will come for the solutions that we need to do to come out of this and become the true leaders in our specialty and in the field of medical fraternity. What is the genesis? How is that? What happens to an anesthesiologist? When you join the postgraduate program, all the undergraduates who join the postgraduate program, they just join inside a specialty which they are not exposed to. Slowly they started developing the skills of learning from their seniors, some of the techniques like starting IV lines, giving a spinal, giving an epidural. But also they start learning about the so-called sense of the anesthesiologist. What is that? They learn from the seniors of how to do a case, how to communicate to a surgeon. Sometimes it's good, sometimes it's bad. They also learn how to cancel a case, how to do a case. They also are highly concerned about economics. I don't know why anesthesiologists are the most important person inside the operating room who always thinks about the cost. When the surgeon doesn't worry about the machine that he has procured for £1 crore, an anesthesiologist will be truly worried about an endotracheal tube which is bought for a few hundred rupees. He wants to know whether to reuse it so that the cost can come down. For some reason, we have got a fabric, a genesis, where for everything we relate to this cost. I think this seems to be a true lacunae. We'll come to it a bit later, but I wanted all of you to think on this. This is a specialty when we have grown under the shadow of the surgeon for time immemorial. We have always been a passive listener to somebody who was commanding the particular surgical operating room. So we always have been nodding the head on several occasions, but when we grew up into an institution, that was the first time when the anesthesiologist wanted to show their authority, and one of the ways they showed their authority was to cancel the cases, and they thought that they've done a great job in cancelling the patient. I wanted all of you to think about this. Gone is the time when we will call our patient. When you talk to a surgeon, you should never tell your patient is not fit. The minute we decide to give anesthesia to our patient, the patient becomes our patient and my patient, and it is no more your patient. Do you all agree with me on this or not? This is a huge change that we need to produce when you deal with the patient whom you are going to give anesthesia. You need to take up the entire responsibility and onus on you, and you have to declare that this is my patient. And if you are going to cancel the case, you should also give a prescription of what you are going to do on the case that you are cancelling, and what is that you expect to change in the internal milieu if you are going to cancel the case. You have to take the entire responsibility, and this will happen if we all take into consideration that every patient whom you anesthetize, if you think that he is related to you, think him as your father or mother or a sister or a brother or a wife or a child. What we will do for them, we will do for our patient. Then most of the challenges that you will face will have a solution. So the genesis of anesthesiologist, 20% is theory, 80% is what we learn from our seniors, and we change our personality into a specific mode called the anesthesiologist personality. And as we grow up, we adopt negative beliefs and false assumptions and sabotaging fears from the world around us. These become our invisible fences. So we should be prepared to break these invisible fences, because anesthesiologists are truly passionate about medicine and they're highly compassionate for their patients. Now, with the permission of the chair, I wanted to give a wake-up call to you. And I want all of you to answer a few questions as a part of understanding of the current day thinking of anesthesiologists about their profession. So shall I go ahead? Thank you, sir. The first question, I wanted all of you to put your hands. The first sign of an anesthesiologist is immense confidence inside. So putting up the hand, it should be like this, it should not be like this, or it should not be like this. Here we declare that we are born, we have become self-confident. So it starts from every act that we do. So the first question that I would ask all of you, I want each and every person in this hall to put their hand up. Do you think you are a leader in your own profession. Oh, please give a big applause to all of us. That shows the confidence in the anesthesiologist. Do you, be honest, do you effectively communicate in your professional life to all those concerned? Extremely good. Do you feel you are getting the due credit? Oh, you see a huge difference here. The first two things, majority of the hands went up, and now the hands have gone less. This is exactly why we will choose this topic, and we will go into this topic. Do you feel you are given the required recognition by the surgeon? Much, much better. Do you think you are happy internally with what you are doing professionally? Excellent. That is superb. Now, this question is divided into three parts. If we think that we have not got the required recognition, what is the biggest challenge which prevented us from getting the required recognition? Who prevented our growth? A. Was it ourselves? Those who say ourselves, please put your hands. Okay? How many of you feel that the surgeons have prevented our growth? Put your hand. And how many of you feel that the administrators have prevented us from growing? Okay, now I see the most important answers were the major responses. I think 50% say that it is because of us, and 50% say it is because of the administration. And the last question, a very pertinent and important question I would like to ask you is, do you think that you are on par with all the other specialities? That is heartening to know. This is surely, you need to give a round of applause to yourself. For the first time I've seen, without doubt, every hands going up. That shows the emergence of leadership in anesthesia. We should all become a leader by ourselves. The president and the secretary are not the leaders. The leader is each one of us, and we should listen to Warren Buffett, what he says. One of the most prominent industrialist and the most richest man on earth, who said, there will never be a better you than you. There will never be a better me than me. We should exert more of our hidden potential. We should liberate more of our natural creativity. There will never be a better day to be better than today. So today we all declare that we would introspect our deficiencies, and we will rise up to see that we become a leader in a profession. We to tear away all the fears that we have as an anesthesiologist, because on the other side of every fear door, we have gorgeous gifts that are left for us. Now, based on the current status, what are the responsibilities of an anesthesiologist, which is mandatory for every anesthesiologist to do? This is a summation of what you need to do in your professional life. If some of you are not doing this, I would kindly request you to introspect on this and try to become a part of the minimum mandatory responsibility of an anesthesiologist of the modern day. Number one, the pre-anesthesia clinic. It's mandatory to see your patients preoperatively, not only for prescribing the anesthetic plan, but for the first time ever you're contacting a patient who didn't come for you. And he's the only question that is in mind of every patient who walks in for a surgery is whether he is going to survive this anesthesia and surgery. They come with tremendous fear inside, whether it is a small circumcision or a major cardiac surgery. The only question is they are really scared. Use this opportunity to show your grace on them, comfort them to make, and they will remember you for life. So pre-anesthetic clinic becomes too important to become visible, to give the enough confidence to your patients who have come with a possibility that they think that they might die during the surgery. Number two, it's so important to communicate with the surgeon elaborately on the type of surgery, the amount of blood loss, the position you keep well in advance, not after anesthetizing the patient. Number 3, have a strategic anesthetic planning which will be good for your patient based upon the comorbidities that are present in him. We also do a lot of skillful work like inserting invasive lines, performing nerve blocks, making a change by incorporating into your practice the new technique and technology that is coming in so that you will enjoy using the new technology, which is extremely good for safe conduct of anesthesia, and also you will feel the happiness of having been part of the technology that has come in our lifetime. So do not stick on to the old techniques, move on to the next level to see that you do your best to your patients. You also supervise continuously the intraoperative period. The best computer on the earth in the medical field is the supercomputer that is the brain of the anesthesiologist who continuously takes inputs in all complicated surgeries from the monitors, from the surgeons, from the surgical field, and he keeps on evolving a strategy in the intraoperative period to make the patient survive. So he is the supercomputer of the medical fraternity. And most importantly, we need to focus. It's not enough when you complete the case, you just wash your hands and go away. It's pertinent that we get into the post-operative period, and you should provide excellent pain relief to our patients. In spite of advancement of technology, technique, availability of pharmacological agents, even currently, globally, all the studies which work on the post-operative pain relief has shown only 50 to 55% of our patients have adequate pain relief. So this is one area which we really need to focus, increase the focus on acute pain service to see that each one of our patients does not have pain. If we all think we can do it, we will evolve a strategy for excellent pain relief. So these are the composition anesthesiologists have to do, basic minimum to give an excellent quality of anesthesia. Apart from the anesthetic skill, he will also be involved in the personal management, like educating the technician, the nurses, and the patient on what he is going to do. I will take the help of the Forbes magazine, which said the top 9 qualities of a good leader. I really wanted all of you to note these 9 points, and I wanted all of you to go back and sit quietly today and introspect on how much of this you are doing today in your practical work and what is that you need to acquire. Number 1 is communication. Number 2 is commitment to the cause. Number 3, the confidence in which you do whatever you do. Number 4, the positive attitude you have towards your patient and life. Delegation of work to people so that you get all the work accomplished in the expected time. Absolute honesty in whatever you do at your professional work. Be inspiring for the people around you, and so that you become a true leader. You work with tremendous amount of intuition to create the next level of leadership, and you need to be very creative in your work so that every day becomes a day to cherish upon, so you do not get into the boredom. So these are the top 9 qualities which every leader has to possess, and I wanted each one of us to introspect and then make everything that's possible to acquire this. Leadership means facing challenges head on, and said Mahatma Gandhi. It sounds so obvious, but it's true that leadership always occurs in moments of challenge, not during moments of ease, which we definitely have to take into consideration. There are plenty of challenges, but there are many more solutions for the challenges that you have. I wanted you to closely follow this wonderful saying. We, all of us here, have a huge responsibility for the next generation. What is that? We are the only Quran they will read in their lifetime. That is our youngsters. The only Vedas they will see. The only Bible they will experience. The only Dharma they will follow. Our lives will either serve as a warning or as an example. It is an awesome responsibility, but how else can you explain why you came into this earth before then? It's a huge responsibility. You are a true role model for all your youngsters. So what you are doing is carefully watched by everyone, and you set an excellent example. So I wanted you to lead by example. And we need, as all of us know, change is the only permanent word for growth. Embrace the new technology and pass on the benefit to the patients. It is always considered what one man could do. What one man could do. And Steve Jobs gave the answer for this. Because the people who are crazy enough to think they can change the world are the ones who do. And he proved himself. So, one person in each department should introspect and should start the process of change in the departments towards growth. And suddenly, if each one of us start doing it, we will see the whole country rise en masse. Former President Dr. APJ Abdul Kalam, when he attended one of our medical meetings, he asked them, what will be the contribution of the doctors in the growth of India, and what will be your contribution in making India a developed nation? There were several answers to these questions. They said they will go to the rural area and treat people. Some of them say they will have free of cost, and some of them they said they will work on a Sunday. But he was not happy with any of the answers. What answer did he say? Abdul Kalam said, if India has to be a developed country, I want each one of the doctors sitting here should become the best in his chosen field. The best anesthesiologist, the best cardiologist, the best pulmonologist, globally. You should start thinking globally, and you should try to be the best in your chosen field. If each one of you become the best in the chosen field, then India will become the best country in the world. Do you all agree with me on this? I think that is a very, very strong message that we need to take for ourselves, that we need to grow. Now, based on all the inputs, I wanted all of you to listen the evolution of solutions that I got for the lacunae that we face now, and I divided it into 7 steps. 7 key steps to become an exceptional leader in the field of anesthesia. And what should we do? Step 1. I'm going to dwell on each of this topic one by one, but the first one is confidence. Second one is passion to the profession. Third one is mastery with passion. Fourth one is communication. Fifth one is adorning additional responsibilities. Sixth one is to transfer the legacy. And the 7th one is to enrich the inner self. What is the first step? What is confidence? When is one very confident? When are you a confident anesthesiologist? You're a confident anesthesiologist when you know everything about your patient, you know everything about the medical disorder that he's suffering from, you know to read the ECG properly, you know to see the echo properly, you become extremely confident. So, if you need to be confident, you have to be a master at work in whatever you're doing. And how is that you will get mastery? You will get a mastery in work by exceeding the expectations of others from you. And more importantly, you should exceed your own expectations of even doing the smallest thing like starting an intravenous line. It doesn't happen suddenly. It happens slowly, but keep the goal of exceeding your own expectations and achieving mastery. How do you exceed your own expectations? Number 1, you should become extremely skillful. And how does it happen? It happens by practice and change. If you are the most skillful anesthesiologist inside the operating room, will you feel confident or not? Yes, you will feel extremely confident. And here there is an important message for all of us who are ascending up in the ladder. When we grow, you get a lot of administrative responsibilities, and slowly you get confined to the table room, into the 4 walls of your operating room, not entering into the operating theatre. This happens to all of us who start growing, but this is the biggest doom that we can ever have. The best anesthesiologist in an operating room should be the head of the department, should be the senior most anesthesiologist in the department. If it is a tough spinal, if it's a tough epidural, if it is a tough airway, if it is a tough block, the best person who can do this should be the head of the department. And then he becomes the true role model for all his postgraduates. So we need to keep this in mind and keep doing not to see our skill levels go down. So skill is very vital. When skill is associated with, accomplished with knowledge, you should become the powerhouse of knowledge. It means that we need to educate ourselves day in and day out on the new things that are happening. If the skill is combined with the knowledge, then we will never ask for pulmonology opinion, cardiology opinion, nephrology opinion, neurology opinion, psychiatry opinion, and make all of them look like God in front of you when you are much more learned than what they can offer to you inside an operating room. So this can happen when you acquire and procure the knowledge to learn the basic minimum things to conduct the anesthesia. So when skill is associated with the knowledge that you possess, your confidence level becomes much more. And when this is combined with your positive personality trait of integrity and honesty, you become superior. And then when you become superior, as you grow, one of the most important character that we need to have with us is the humility with which you approach everyone who comes around you. To be humble, humility is an essential element in the creation of a beautiful legacy. When you grow up in the 6th and the 7th decade of life, every postgraduate, every junior who worked with you should say, this particular doctor is a legend. He created a legacy. He created me, and you will remain your footprints on this earth long after you have left this world. So humility should join. If you have all this together, excellence become a part of you. And as you know, excellence is never an accident. If Mahendra Singh Dhoni hits a 6 in the last ball in a T20 match, when the last ball you wanted a 6 and he scores a 6, he becomes a leader. He becomes a leader of the masses. Similarly, the senior most anesthesiologist should be the person who delivers always and ever to become a constant inspiration to all the juniors who are present. So when you have acquired the confidence, next thing you should have the passion to perform whatever you do. The typical example for this is the Wright brothers. Way back when everybody was trying to find out how to fly an aircraft, there were many universities which were funded with enormous number, billions of dollars to develop an aircraft, but it didn't materialize. It required the passion of the Wright brothers sitting in one rural area of United States, thinking constantly of how to fly an aircraft, absolutely uneducated, no funding available whatsoever, but they succeeded in flying the first aircraft ever known to mankind. So do not blame on the infrastructure that we don't have this, we don't have that for our growth. It's just passion when it joins with confidence, you go to the next level of anesthesia. Every day is a gift to us, and we need to utilize to the best of our abilities. And sometimes, this is a very crucial point. In India, we have been the world leaders until the 14th century. But with the advent of colonization, we lost our glory. We were plundered of our wealth. We were plundered of our brains. We were plundered of our thinking, that we became a constant slave to people who ruled us. So we stopped thinking. We have a fear in all that what we do, and we wanted somebody to take the first step to follow. So sometimes when everyone is waiting for someone else to take the first step, you need to be the one who will drive the change and take the first step towards growth and prosperity. This is another important quote which I want to say. What one thing you should ask when you get up in the morning every day, each one of us should ask ourselves, what one thing could I do today that if I did it, my professional and personal life would get into its next level of greatness? We should think it every day. Then automatically we will start growing in whatever we do. So we go to the step 3. Step 1 was confidence. Step 2 was passion. And when confidence and passion join together, you are the most skillful, the most learned, the most passionate anesthesiologist inside the operating room. And when you are there, you will believe, you will realize that you are highly respected by your surgeon, by your nurses, by your fellow colleagues. And when you start realizing that you have earned the respect of all the people around you, that is the time that you start acting. So how do you act? Now, what happens is, when you have achieved this level of excellence, next thing is you should start communicating. And what is that? Good things happen to good people who do good things. Do the right things and you cannot help but see the right results. So now, you are a respected leader inside the operating room. Now, you start communicating your requirements to the surgeons, to the patient, to your colleagues, to the administration, because they need a lot of help from you. You need to assure quality, work in hand with the administration to implement ideas. The minute you reach the respect status, even the administrator will come to you and ask for your help, because he knows you are the right person who can deliver a solution for all their problems. This is too crucial. We have come to a stage where we need to work closely with the industry. We need to give the feedback of what we do clinically to the industry to develop technology and drugs which help us to grow. And the industry and the anesthesiologist have to go hand in glove to push this fraternity of anesthesia to greater levels so that safety is practiced in all that we do. The most important thing which we fail to do is to communicate with the society on the best things that you do. And most importantly, you should start doing it with every patient whom you are seeing. You tell them what you are going to do, and you tell them that what is the things which has made a difference in the way anesthesia is done. So a great opportunity is to communicate to all your patients and the society on what you do. Now, we go to the stage 5. What is the stage 5? Stage 5 is taking additional responsibility as a leader without making an excuse. What are the additional responsibilities? Do you know the maximum number of blood transfusion in this world is done by anesthesiologists? It is done by the anesthesiologist. Maximum number of intravenous infusions are done by the anesthesiologist. The maximum number of drugs which is used in critical care is used by the anesthesiologist. The maximum number of resuscitation in this world is done by the anesthesiologist. So there is no other better person than an anesthesiologist who could become the chairperson of their blood transfusion committee, the infection control committee, and the pharmacological committee. So you should permeate into these committees to show your expertise and share your thoughts. Many of them used to say, I'm only an anesthesiologist. If today is the day we declare that we will never use this word, I am only an anesthesiologist. Just throw away the only. And this is the day that you take into consideration. Whenever you go for any committee meeting in the hospital, you should also add on a white coat and go. It is not only for all the other clinical specialties, even for each one of us. So those who don't have a white coat should stitch a white coat. When you go to the committee meeting, put your name and say an anesthesiologist, and you should go to the committee meeting. That will dawn a new era in the way we look at life. Do not equate everything to the money. The time you spend in the committees, do not expect a return back. This is the sacrifice that you do to see that your specialty is going to go to the next level. Next is to contribute to the specialty, and India is in a crucial stage now because we have immense amount of cases and population. This is the time that we have to embark upon auditing all our practices, incorporate new technology, keep extremely proper records, share the experience with fellow colleagues, and involve in clinical research. In 10 years from now, India should emerge as the medical capital of the world because we do more number of cases than anybody else. The maximum number of publications have to come from this country, and the Indian Society of Anesthesiologists should take the lead in making this happen. And I'm sure the President and Secretary will really work on this to make this happen. And we need to keep on learning. And how do we do this? We have to subscribe at least to one journal. Every anesthesiologist has to subscribe at least to one journal and then read the journal. Number 2, visit centers of excellence. It's very important inside the country. You need to move around, even if it's for 1 week. Visit centers of excellence, because that will help you to grow tremendously, because you will see new practices. At least make sure that every 2 years you attend one international meet to make sure that there is not a huge gap between you and the rest of the world. This will propel you forward. So that is the step 5 of leadership. Step 6. Pass on the beautiful legacy that you have acquired by your experience to your next generation. Give it off totally. Don't hide anything. The best epidural technique you have is to teach your younger generation. There is a selfish motive in this. You know what is the selfish motive? You might be the best anesthesiologist in your town, but if you have not passed on your legacy to anybody else, when you become the patient, there is nobody to give you an epidural. So there is a selfish motive in doing what this is that you have to do, that you have to pass on your legacy without any inhibitions to your juniors, and we should start creating shared leadership so that collectively we can grow. Inside a department, when you enter, there should be no negative force. There should not be too much ego between two people. Then 80% of the time goes in fighting, and we forget for excellence. So please, we will go for a collective leadership. And I come to the last 7th step, which I consider is extremely important. That is to enrich your inner self. So how do you enrich your inner self? You need to be happy always, with lot of inner peace if you want to be a leader. There is an excellent Japanese proverb which I wanted to share with you. Inside each one of us, there are 3 people. The first person is the one who behaves outside for the outside world. He will be at the best of his senses. He is not the true person, but he will behave as he is the best. That is the person to the world. Then the next one is the person to the family. The family knows much more of your inadequacies. And the third one is the person in you, yourself. You know yourself what you are. So if the difference between person 1 and person 3, that is the person of you whom you present to the world and the person of you whom you are inside, if this gap is less, you are going to have inner peace all the time. And then you need to manage your time and do balanced activities. And the last thing is, absolutely you need to have a happy home. An excellent quality of time you need to spend with your children, however you are busy, because they are the true buffers. And they are the emotional component of your life. Just because we are busy, we cannot neglect our children and family. If the family is happy and peaceful, you automatically become a leader in your profession when you go to work, because there is no negative thought. The day that you fought with your wife or your husband, even the simple spinal becomes the most difficult spinal when you enter the operating room. So many people acknowledge this. So this is a strategy that leaders have to evolve for life leadership. What is that? This is from a research that has been conducted. 1 hour each day is for physical wellness. 1 hour is for reading and contemplation. 1 hour for the emotional balance with the family. 1 hour for the futuristic growth. And 1 hour for introspection and spiritual needs. Even if you are not able to do all together, per week, you should see that you concentrate on these 5 aspects. And believe me that all those who have done that, in whatever profession they choose, are the leading leaders in their respective profession. The happiest people don't have the best of everything. They just make the best of everything. And we all should make the best of everything that we have. We need to be the change that what Mahatma Gandhi said. We have a chance now. As a true professional, of the millions of people born in this world, God has gifted only very few as a special children and very few as an anesthesiologist. So you are the chosen children of God, and please do not miss an opportunity.
There you go, straight up. It's a chance. He should be out. They're coming. 3 of them are coming. Are they calling? Are they calling? No, they're not. Do they...
Let this not be a dropped catch. Let us all think over it and grab this opportunity to succeed in life. If we do not use each day to do even one thing to make your mark and to advance your vision and to become your brilliance, you may miss what truly counts. As Swami Vivekananda said, arise, awake, and stop not till your goal is reached. This is a beautiful sentence of one of the best thinkers, Stephen Covey, who said, between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom. So we will choose the right thing for progress. This is another important statement. Everyone who is causing you stress, struggle, and challenge in your life are just the angels of sorts. They are carrying the lessons you must need to learn. If somebody is giving you trouble, you please consider them as an angel, because they allow you to grow, because they made you think and they made you come out of the challenge that they posed. So you become enriched. You become a better person than yesterday because of the detractors that you have. Do not be submissive, but come over it. This is a very important statement which I wanted you to focus. Great leaders of the 21st century are preparing themselves not for the comfortable predictability of yesterday, but the realities of today and the unknown possibilities of tomorrow. So let us keep this in our mind, and we should have a very strong core value when you leave this hall. Success is all about being in the process of joyfully creating a life that reflects your highest values, your deepest beliefs, and your greatest dreams. So make your core values very, very strong. When any of you in your department thinks about you, only 3 words have to come to their mind. They have to tell you, oh, this person is truly innovative. Oh, he is world class. Oh, he is very unique. These are the 3 words that each one of us should strive to be in whatever we choose, and then you emerge into a true, absolute leader. Whatever be the age, unleash the child in you. A child is the one who wants to do everything, explore everything, and he's very passionate in whatever he's doing. Irrespective of the age, those who are present here, we will unleash the child inside to conquer for the best. I repeat, each one of us here are a true role models for our children. Our lives will either serve as a warning or an example to the people around us. It's an awesome responsibility, but how else can you explain why you came into this earth before them? Time has come to emerge as the most powerful leaders in medical fraternity in the entire globe. We have become an IT superpower. We have become a space technology superpower. We have created white revolution, pink revolution. Now has the time come for a medical revolution to happen. You and me should contribute to India to emerge as the most powerful nation on earth as far as medical delivery is concerned, and I am extremely confident that we will be able to do when each one of us tell ourselves to become best than before, to inculcate into us the qualities that we discussed. We are going to be the true leaders, and I have no doubts about that. And I would consider that each person inside this hall should tell themselves that they are a true leader in the making. When you go outside this hall, I do not want you to shelve away what we discussed in this 1 hour. To give lot of meaning to the life that God has created to us, let us lead a life of passion and compassion to grow, and then emerge an excellent anesthesiology for the future generation. And anesthesiology will become the most wanted specialty by every medical student who comes into medicine, because we deserve it. Thank you very much for your patient hearing, and I'm sure you will do the best to do it happen.
Thank you very much, Dr. Balavenkat. Really, you have shown the leadership and we have experienced it. I hope definitely your interests and the way you are teaching practically and the way you have become a recognized trainer for the worldwide students in anesthesiology and the way you have established the AORA and the way you are conducting yourself in different conferences, definitely it shows your leadership. So, thanks. Thank you very much for sharing with us. Thank you, sir. And regarding this Venkat Rao's oration, actually, I do not know when it has started. I think Dr. Radhakrishnan can tell the year of Venkat Rao oration started. 1992, Venkat Rao oration started. Actually, it was started by about 25,000 rupees from the savings of the All India Hyderabad conference. And later, when Dr. Radhakrishnan was the president, he thought that these mega amounts are not sufficient for a good oration or a program. So he has asked everybody to increase their the contribution for the orations, not only orations, even all the programs. So then yes, his daughters have come here and they have donated 5 lakhs. And Dr. Tagore is very much instrumental for that amount to come. They have given a DD, and that is how the Venkat Rao oration is the most researched oration in our society. I hope the other programs like, since Balavenkat is here, the gold coin quiz, which is now running with 1,60,000 rupees. I feel that all the Coimbatore members to contribute more to a tune of 5 lakhs so that a good quiz program can be held throughout India and it can be taken to the for the annual conference for the finals. So I request the Secretary and President of the Coimbatore City Branch, of course, I have already asked Sudarshan to contribute more. He said he will do it after South Zone Conference, and South Zone Conference was over about 1 year back, and I am still waiting for his response. Thank you very much. Thank you.
Thank you, sir. Thank you, Dr. M.V. Bhimeshwar, the Honorary Secretary, ISA National, and Dr. S.S.C. Chakra Rao, the President, ISA National, for chairing the session.